Cardiovascular diseases, or CVDs, are the number one cause of death globally. More people die annually from CVDs than from any other cause. An estimated 17.9 million people die of CVDs every year. That is an estimated 31% of all deaths worldwide, according to the Center for Disease Control and Prevention. Cardiovascular diseases account for around 28% of total deaths in India. Approximately every 40 seconds, an American will have a heart attack, and in England, there is one death every 4 minutes because of CVDs. Specifically in India, cardiovascular diseases have now become the leading cause of mortality. This epidemiological transition has largely been because of the increase in the prevalence of CVD risk factors in India. The rate of consumption of fruit and vegetables is low in the country. This is contrary to the perception that Indians, being predominantly vegetarians, would consume adequate quantities of fruit and vegetables. Further, 275 million individuals aged under 15 years consume tobacco in India. What leads to cardiovascular diseases? The exact cause of CVD isn't clear, but there are lots of things that can increase your risk. These risk factors are high blood pressure, smoking, high cholesterol, diabetes, inactivity, being overweight or obese, a family history of CVD, an ethnic background, among several others. Men are more likely to develop CVD at an earlier age than women. CVD is also most common in people over 50, and your risk of developing it increases as you get older. Can heart attacks be prevented? You will be the judge by the end of today's show. Coronary artery disease is the narrowing or blockage of the coronary arteries, which can lead to heart attacks. Conventional coronary artery disease risk factors might potentially explain at least 90% of the attributable risk of coronary artery disease. For years, it has been said that the kind of lifestyle one has an impact on the prevalence of coronary artery disease. It has been proven by innumerable research studies that the primary prevention of cardiovascular disease is possible with certain lifestyle changes. Keeping a check on one's blood pressure, diet, cholesterol, diabetes, smoking habits, and regular exercise are primary prevention recommendations by the American College of Cardiology. Globally, people's diets are deteriorating, and this is a huge cause of concern for cardiovascular health. This is Arushi Karkwal, Democracy News Live from New Delhi.
Good evening, I'm Rohit Gandhi and you're watching Democracy News Live. Welcome to our show, It Matters. Today, we're discussing something that impacts each one of us. We're here discussing the world's leading cause of mortality. That is cardiovascular diseases. When it comes to our bodies, there is nothing more important than a healthy heart, and there is a lot that can be done to make sure that on an everyday basis we can maintain its health. Cardiovascular health that many of us do not do. We are here to discuss cardiovascular health with experts in the field of cardiology. Joining us today is Dr. Sumant Lamba. He's an MBBS, MD, FACC, FSCAI. He's based in Florida. Also joining us today is Dr. Vaqar Ali. He's an MBBS, MD, FACC, FSCAI, FABBM. Dr. Ali has completed his medical residency at St. Vincent's Medical Center in the New York Medical College in Staten Island. Also joining us today is Brenda Murphy. Brenda Murphy is a certified heart failure nurse. She's a member of the American Association of Nurse Practitioners, Preventive Cardiovascular Nurses, and Critical Care Association. Thank you for joining me on the show. Dr. Lamba, let me start by asking you, what does it take to maintain a healthy heart? And how come it has become one of the world's largest issues with mortality?
So to underscore that point, I'd like to tell you a fascinating tale that involves epidemiology of coronary artery disease. So as you know, as you pointed out, that cardiovascular disease is leading cause of mortality. The reason why people die of cardiovascular disease is because they have heart attacks or myocardial infarction, which is caused by buildup of plaque and calcium in the coronary arteries. These are the arteries that supply blood to the heart muscle, and it's progressive narrowing of these arteries which causes lack of blood supply to the heart muscle. And if there's no blood to the heart muscle, that is when patients have a heart attack. So there was a mentor of mine and some colleagues set out to answer this question. Was coronary artery disease always around? Number one. And number two is, how can it be prevented? So as way of trying to figure out, was it always around, they got permission from the Egyptian government and exhumed about 350 mummies. Then they did scans. So we typically screen people for coronary disease by doing calcium scans or coronary CTs on their heart arteries. And we come up with a composite calcium score in the arteries, which predicts risk of disease. So they took these mummies and did scans on them and did autopsies, and much to their chagrin, found that they had very high percentile of coronary calcification, more than 90% when compared to modern times. They attributed this to unhealthy living, goat eaters, primarily animal protein, sedentary lifestyle, etc., etc. Long story short, they found another group of Indians, Inuit Indians, Eskimos, living in Peru, in North Atlantic. So they also had tremendous coronary calcification. And they attributed this to the fact that they cooked in confined environment and were subject to a lot of smoke. So they said, let's try to find a cohort of individuals in the world that have the lowest incidence of, firstly, coronary calcification. Number two would be their LDL, or their bad cholesterol, and then follow these people if they have heart attacks. So they tracked down this indigent group of Indians called Chinami Indians in Bolivia. They rode boats, they went up there, and they studied this cohort, this population, and realized a couple of things. That these were extremely healthy group of people who never had heart attacks. They, on the other hand, died of infections seen in tropical countries. So they tried to figure out why is it that they don't have heart attacks. So when they did calcium scans on them, they found that more than 90% of the patient or the population had less than 10 percentile of coronary calcification. So the hearts did not have plaques and calcium. Then they checked their cholesterols, and the LDL, which is the bad cholesterol, in their case was 55 milligrams per deciliter. That was the mean of the entire community. That is the lowest cholesterol recorded of any community in the world. So then they followed these people over a period of 3 to 5 years, and they put Fitbits on them, they tracked their activity, and they realized that they walked about 20,000 steps a day. And they were primarily hunters and farmers. Their fish and their supplies, they took it to the market, but it took them 3 days to row a boat to the market, sell their goods, and 3 days to come back. So extremely physical lifestyle. So they followed these patients over 3 years, and they revisited them after 3 years, except this time they weren't rowing motorboats. They were using motorboats and not rowing boats. And now the same journey, which took them 3 days, took them 3 hours. And when they went to the market, they saw these colorful packets, red and green and yellow, and they started eating the contents. Those packets, colorful packets, attractive packets, were potato chips. The mean cholesterol of the entire community went from 55 to 110 in 3 years because of lack of physical activity and change in their diet. So I pose the question to you, Rohit. Do you think coronary artery disease can be prevented?
I'm pretty sure it can be, and I think there are a lot of people out there who live without it. So, when you, just for context, now from 55 to 110, what does it mean in real medical terms? How much is bad and how much is good? What is the number which works, and where do you need to keep
Right.
your LDL at?
Less than 100. So the guidelines now call for as low LDL in patients with established coronary disease, but in the general population, LDL of less than 100 will protect you from developing coronary disease.
Right. Let me bring in Brenda and Dr. Ali in, if Dr. Ali is here yet. Well, let me bring in Brenda first. Brenda, you have dealt with this for many, many years. Explain to me, what do you tell your patients, or what do you tell people when they come with challenges with their cardiovascular health?
Well, it's very interesting that you asked that question, because this is something that the trend is that I'm seeing coming from 20-year-olds, 30-year-olds, 40-year-olds, 50-year-olds, both male and female, in the office, one-on-one in the clinic, in the hospital, and rounds. They're asking me, what can I do to prevent? I don't want to have a heart attack like my grandmother and my grandfather did in their 60s. I don't want to have a heart attack like my mother, father did in their 40s and 50s. So they're asking me questions. What can I do to prevent? And it's an excellent question. So much that it grabbed the attention of the American Heart Association. They came up, their idea was achieving these metrics, and these metrics included no smoking, avoiding smoking, having a healthy weight, maintaining a healthy weight, achieving it and keeping it, eating a balanced meal, reaching goals for your cholesterol, which Dr. Lamba talked about with the LDL, the bad cholesterol, reaching target goals for your blood pressure as well as your blood glucose. That wasn't good enough for the American College of Cardiology. We found in some studies that despite these metrics, only 17% of the population could even achieve 5 of the metrics. So they felt like not only these metrics needed to be achieved, but it needed to come from a collaborative initiative, not only from the patient, but from the primary provider, their extenders, their PA, their nurse practitioners. We're now including nephrology, the kidney doctor, cardiology, their extenders, diabetes, the endocrinologist and their extenders, the dietitians, sleep apnea physician. So we're making it quite a collaborative, so it's constant reinforcement of meeting these metrics.
Okay. So, from both your, statements, your opening statements, Dr. Lamba and Brenda, what you're saying is one of the first thing is getting out of your little, sedentary lifestyle. What you need to do is be able to extend yourself, walk, exercise. That's the starting point. Beyond that, food is what you're also saying is a big part of this, and constant monitoring is. Dr. Lamba, what are your basic levels? Like, is it across the board? There is certain metrics you need to follow to be able to achieve it, or
let me take this opportunity. Right. So let me take this opportunity to underscore the fact that there is absolutely no doubt in our community, the scientific or cardiovascular community, that the only way to prevent plaque buildup in arteries is to turn to plant-based diet. Absolutely. So we know that the only thing that causes regression of atherosclerosis is in fact a plant-based diet. So in that regard, any animal protein, including dairy, is not good for you. So, and if you look at the countries where coronary artery disease is the lowest amongst the world, it's around the Mediterranean. A typical Mediterranean diet consists of, the more colorful the food, the better it is. Fruits, vegetables, green leafy vegetables, nuts, legumes, cereals, lentils, red wine, dark chocolate. That is the way to prevent coronary disease.
And I like the red wine part of it. So I think it'll work pretty well. I'm going to concentrate on that for now. But so I take your point, Dr. Lamba, is that less meat, less dairy, and going in for more, fibrous, good, diet, and along with that, exercise is the most important. Now, Brenda, let me come to you with a responder, perspective. Let's say today you are suffering from the disease. What do you do to make sure you protect yourselves? And if you go through something, how do you make sure that you're able to come out of it? And you're all of a sudden faced with a situation where you have a little heart attack. What do you do?
So excellent question. So it goes back to risk factors. What do obviously I have fallen into a risk factor bracket. What can I do to modify those risk factors? And going back to the American College of Cardiology, they came up with a great mnemonic. It's very easy to remember. It's called the ABCDE. And A is for aspirin. For these high-risk patients who need to be on an aspirin unless otherwise contraindicated. B is adequate blood pressure control. We're shooting for blood pressures less than 130/80 now. C would be cigarettes, no smoking, absolutely no smoking. That puts me in a higher bracket. In addition to that is cholesterol. Again, the target is to get it to below 100 for the bad cholesterol, the LDL. Now we're shooting them down into the 30s, and Dr. Lamba will speak more on that topic. D would be diet. Again, he hit on the Mediterranean diet. Stay away from processed foods, sweetened, sugary drinks, carbohydrates, high carbohydrates. Get your glycemic control down as low as possible. E is exercise. We're talking about, for guidelines, getting in an exercise greater than 150 minutes per week. And it sounds like a lot of time exercising, but when you break it down, it's really less than 20 minutes a day to get out and exercise. That's it.
Oh, very good points. I think it makes sense anyways for a healthy lifestyle. But if you aren't doing any of these and then turn around and blame everybody else, making sure that the food chain and all of that for it won't work. Dr. Lamba, let's talk a bit about when we talk about numbers, where should the numbers be for a person to be called healthy and not exposed to the cardiovascular challenge? If you that.
So firstly, your body mass index, that's your body weight divided by body surface area, or your height, should be less than 25. Particularly in Southeast Asians, we tend to have the metabolic syndrome and adverse milieu for atherosclerosis, even with a BMI of 25. So for South Asians, I would say a BMI around 20. Recognize that a BMI between 25 and 30 qualifies as overweight, and above 30 is obese. 50% of America will be obese by 2030. That's the kind of epidemic we're facing. So that's the first thing, is the body weight. Second thing we're talking about is blood pressure control. So anything more than 130/80 is now hypertension. So your blood pressure should be less than 130/80. And if it's above that, we recommend, along with lifestyle modification, antihypertensive therapy. The third that we talked about was obviously your cholesterol. And for that, it's really the ratio of your LDL to HDL. So higher your HDL, you're protected. Anything more than 60 is protective. LDL is your bad cholesterol, and that needs to be as low as possible. When somebody with not any risk factors for coronary disease, less than 130. If they have risk factors for coronary disease, less than 100. That's 3. Number 4 is blood sugar control or diabetes. Recognize that we can have glucose intolerance, which would constitute as one of the components of metabolic syndrome. So essentially, if you have in men a waist of more than 40, women a waist more than 35, your HDL is less than 35, your triglycerides are more than 150, your blood pressure is more than 130/80, your blood sugar is 90 to 100, and you have if you're a woman, you have polycystic ovarian disease. Out of these 6, if you have 3, you have what is known as the metabolic syndrome, which is a precursor to atherosclerosis, or this cholesterol plaque buildup. If you have the metabolic syndrome, you have 20 times the incidence of having coronary disease or cardiovascular disease. So if we hit each one of these, so again, coming down to BMI, lipids, blood pressure, and blood sugar, along with all the other preventative stuff we talked about.
Dr. Lamba, I think if somebody actually begins understanding this and following this properly, we would certainly bring down cardiovascular disease. And, it's become more of a lifestyle disease as well, because, the sedentary lifestyles people lead around the world, people have time to make the money, but they don't have time to exercise and don't have time to, just breathe. People are spending more time on the phone today. Dr. Ali's joined us now. Dr. Ali, we've been talking about, the health parameters that need to be maintained. There's also preventive health that, in food and all of that. Would you want to weigh in also and tell us a bit about what are your findings? What is the most important thing you would point out as 3 most important things to make sure that you have a healthy heart and you bring down the possibilities of cardiovascular diseases?
Yeah, I think what Dr. Lamba and Brenda mentioned earlier, it's important to just control your risk factors. And obviously there's genetics, and we can't do anything about that. And a lot of cardiovascular disease is genetics. Then the modifiable cardiovascular risk factors are your hypertension, like Dr. Lamba mentioned, hyperlipidemia, smoking cessation, diabetes control, and exercise. And obviously by doing that, reducing or controlling your BMI. Also diet, and there's a lot of data now on vegan diet and especially paleo diet. So those diets are also have been shown, vegetarian diets have shown to regress plaque in coronary disease, and this is intravascular ultrasound proven data. So I think those things do matter. And my field is mostly, obviously I'm an interventional cardiologist, but I do structural heart disease as well. So that does translate into valvular heart disease, which is also calcific, specifically in the United States. Of course, in Southeast Asia, it's mostly infectious or infective endocarditis related, and then subsequently can be calcific as well. So we do see the translation affecting into the structural heart disease as well of these risk factors that can be modified.
So, Dr. Ali, what you're saying is obviously back to, genetically what you have, you can't really change, but then you can still modify your lifestyle. You can still modify what you put in your mouth to be able to make sure that you are able to reduce that risk, even though you may be genetically predisposed to the disease.
And I think there is data that Dr. Lamba is well aware of, that if you do follow a regimented program of exercise, diet, and risk factor modification, you can regress coronary artery disease. Of course, you have medications to help you with that as well, but other things are also very, very effective, and no doubt about that.
Very important topic. Dr. Lamba, Brenda, Dr. Ali, thank you very much for joining us. It's a really important part to understand how we can reduce the risk of cardiovascular disease. It is one of the diseases which causes the highest mortality, and there is a way to bring it down and actually make sure that you can protect yourself even though you may be genetically predisposed to it, is a very important part of it. Thank you very much for joining us for a very important discussion. And viewers, as you watch this, the idea is to make sure that you understand that this is not something that you have to live with, and to prevent it is really basic. It's your diet, it's your how you spend your time. Don't lead a life which is sedentary. Get out there, exercise, and you should be fine. Thanks for watching. Good night and good luck.